Is Clonus normal in infants? If you're a parent or caregiver wondering about the normalcy of Clonus in infants, you're not alone. Let's break down what Clonus is and whether it's something to be concerned about in young children. Clonus is a type of reflex that involves rhythmic, oscillating movements, often seen in the ankle. It's essentially a stretch reflex that can be triggered by quickly flexing the foot upward. In adults and older children, Clonus is usually a sign of an upper motor neuron lesion, which means there's an issue with the brain or spinal cord. Now, when it comes to infants, the situation is a bit different. In the first few weeks of life, a few beats of ankle clonus can actually be normal. This is because the nervous system of newborns is still developing, and some reflexes that might seem abnormal in older children can be part of this normal development. However, if the clonus persists or is sustained, it's a different story. Sustained ankle clonus at any age in infants is generally considered abnormal. For instance, if the clonus lasts for more than 10 beats, it's a sign that something might be wrong, and it could indicate issues like cerebral palsy, mental retardation, or other neurologic problems. To determine if the clonus is normal or not, doctors look at several factors, including the age of the infant, the duration of the clonus, and whether there are other neurologic signs present. For example, if an infant has more than 10 beats of ankle clonus at any age, or if the clonus persists beyond 8 months of age, it's usually a sign of an underlying neurologic issue. During a neurologic examination, doctors will also observe the infant's overall behavior, physical appearance, and other reflexes to get a complete picture. They might use simple tools like toys or a bell to engage the child and assess their responses. In summary, while a few beats of ankle clonus can be normal in the first few weeks of an infant's life, sustained clonus is always a cause for concern and should be evaluated by a healthcare professional. If you notice any unusual reflexes or behaviors in your infant, it's always best to consult with a doctor to ensure everything is okay.